Welcome back, everybody. Coming back to you live from my breakfast nook yet again here. Again, we'll kind of continue last slideshow here. We were taking a look at basically what was blood pressure and what are the ways that we could kind of measure it and some of the ways that was going to influence blood flow. Today, what I really want to talk about is some of the main physiological regulators of blood pressure. So these things that are going to influence blood pressure, either increasing it or decreasing it. And we're going to talk about a number of things. So on the next slide, I'll actually show you a little kind of flow chart of some of the different things that influence blood pressure. We're going to see some of these things are things that we actually physiologically regulate. So for example, cardiac output. We can increase or decrease cardiac output physiologically. That will bring about changes in blood pressure. It is one of the ways we actually regulate blood pressure. We'll see things like blood viscosity. If you have thicker blood, it will influence blood pressure. It is not, however, a way that we're going to actually try to influence our blood pressure. So we are not going to thicken or thin our blood as a way to either raise or decrease our blood pressure. This is something, however, if it is occurring, that the body is going to have to compensate for. And these are the things that I want you to kind of try to be able to differentiate when we're talking about something being a physiologic regulator versus other things that will influence blood pressure but not necessarily regulate it. The other thing I want to have you focus on this as well is on any of these, we are going to be talking about specifically one thing or the other that may increase or decrease blood pressure. If I'm asking a question on this stuff, I want you guys to kind of realize that we are looking at this in everything else remaining the same. Increases in heart rate would do what to blood pressure, for example. If you start trying to read in too many other variables that I'm not stating, those are going to make things difficult to kind of bring this about. So to me, overall, I want you to understand how these different things are going to kind of work together to regulate blood pressure and that it's happening at a number of different levels. But again, as we're talking about on any particular question, when we get to testing on this stuff, specifically if I'm asking about one thing, don't try to think about any other stuff. If I say increased cardiac output does what to blood pressure, it would be increase it. You can't start worrying about what the vessels are doing or what blood volume is doing, otherwise that question becomes not answerable. So to start out with, we're going to start talking about these different factors that are going to regulate or influence blood pressure. Again, keeping in mind what's physiologic, regulating it versus things that are just going to influence it. And you can see this little flow chart that would be in a number of the different textbooks here. You can see how it's bringing in a few different things here. We're going to kind of touch back on this one here, but you can kind of see even looking at this one here, if I take my cursor and kind of show you right here, heart rate increases, stroke volume increases. Those we know, if you multiply heart rate times stroke volume, you get cardiac output. So these two factors right here are actually going to be a influence of cardiac output. We're going to talk about peripheral resistance and what that is in a little bit. It's basically the friction of the blood vessels on the blood. One of the things that would influence that is the viscosity of the blood. So this is going to be our second level of kind of regulation here. And we will introduce the idea of blood volume changes, but what we will actually end up doing is how we actually regulate that. I will talk about in the following show after this one. So to start with, the first thing we're going to kind of take a look at in terms of physiologic regulators is going to be cardiac output. So we've talked about cardiac output when we were talking about the heart, and with that we talked about a number of things like preload, afterload, those chronotropic factors, as well as the inotropic factors. All these things, in reality, because they influence cardiac output, would also be regulators of blood pressure. Cardiac output, to me, is kind of our first level regulator. Heart rate changes can happen at a very quick time scale. This is kind of, let's say you go from laying down to sitting up and you need to keep that blood pressure up to the brain so you don't pass out. The cardiac output is generally going to be what's in charge of this. So I was kind of talking about it as the first level regulator, this short acting, quick moving type of regulator of blood pressure. Again, the only way to keep this maintained, these changes in blood pressure, is to keep those output up. So again, a lot of times it's not a long-term solution to changes that we need to make in blood pressure, but it is a good, quick acting process in order to kind of get that up. So, in a simple sense, cardiac output, the higher the output, the higher the blood pressure is going to be, everything else remaining the same. So increases in heart rate, which would increase cardiac output, increases in contractility, which would increase cardiac output, increases in stroke volume. All these things would lead to increases in blood pressure with everything else remaining the same. So, like it says there, the faster the heart rate, we're going to get an increase in cardiac output. Faster the stroke volume, we're going to get an increase in get an increase in blood pressure. And again, like it says there, as cardiac output increases, blood pressure is going to increase. And again, if the opposite is true. The only way this isn't true is if the heart is beating at a speed that the venous return is not capable of supplying it. So as long as the venous return is getting back to the heart to supply the blood that the heart is trying to put out, any increase in cardiac output is going to cause a corresponding change in blood pressure. Again, everything else remaining the same. So things that are going to influence cardiac output, like we talked about before, we talked about those things that were going to influence heart rate. So we talked about those chronotropic agents, those things that would either increase or decrease heart rate. Anything that would increase heart rate is going to be a positive increaser of blood pressure as an influence. Any negative chronotropic agent that would slow the heart rate, such as the parasympathetic nervous system and that the acetylcholine's effect from the parasympathetic on the heart, those would be things that were going to decrease blood pressure. We also talked about a number of different stroke volume influencers. Things like those inotropic agents, things that were going to either increase or decrease contractility. If that particular thing increases stroke volume, it will increase blood pressure. Everything else remaining the same. So those positive inotropic agents, preload, both those things would be things that would increase stroke volume and would therefore increase blood pressure. Things like negative inotropic agents or things like afterload, both of which would decrease stroke volume, are going to be things that would decrease blood pressure. Again, everything else remaining the same. So that kind of gives us how cardiac output is going to influence this. Again, it's a quick acting, quick moving type of system that's going to allow us to make really quick changes. Our second level regulator is going to be really the blood vessel diameter, or radius, but again, an increase in radius is going to be an increase in diameter, so you can kind of use those ideas interchangeably. This is going to be part of that vasomotor response, where your blood vessels can either constrict or dilate to either open up more with the dilation, so get bigger, or constrict down smaller. What these are going to do is they're going to change pretty much the levels of what is called peripheral resistance. This is resistance or friction of the blood vessel walls on the blood, and the reason we call it peripheral is it's out in the blood vessels, not within the heart. So the resistance, like I said, is this friction of the blood traveling along the vessel wall. And again, it's due to the contact of that blood rubbing against the vessel wall. And like it says there, that is going to kind of put friction on this, opposes that total flow, so we're going to see that this is going to increase pressure the more resistance we have. So peripheral resistance, like I was saying, is the resistance of the blood in the blood vessels. And this is going to be affected by a few different things. The thickness of the blood, so the thicker the solution, the more pressure it's going to take to move it through. Vessel length is going to be another thing. If you have more vessels, you have more wall. That would also influence that peripheral resistance. But the one thing that we're going to see is the lumen size, or that lumen diameter or radius, is going to be the only one of these that we can actually physiologically change through our sympathetic or parasympathetic nervous systems to either vasoconstrict or vasodilate in order to change that actual peripheral resistance physiologically. So I'll start with the ones that are not actually good that are not physiologic regulators of this. Blood viscosity is just the thickness of the blood. If you get more formed elements, less fluid in the blood, this is going to be all things that are going to change that thickness, increase the thickness of that blood. We've already kind of said blood is about 5 times more viscous than water with the formed elements. If you are doing something at altitude, let's say, and you've increased your hematocrit from the 45% that it normally is, and let's say it's up at 60% now, that is going to make your blood thicker. One of the things that a lot of times happens with that is going to be a corresponding increase in blood pressure because of that increased thickness in the blood. And it is one of the things when you get to altitude sickness, a lot of these are actually side effects of that increase in pressure. So things like cerebral edema, you're pushing too much pressure through, so you're pushing fluids out into the brain, or pulmonary edema, pushing fluids out of that blood supply due to blood pressure into the lungs. Again, not something that we physiologically regulate. So if your blood pressure is a little low, your body does not thicken your blood to try to bring it up. And again, any change in this is going to do this. So lower viscosity, less resistance, it's going to flow more freely, allows blood pressure is going to be lower in that circumstance. With dehydration, you're going to see increases in blood pressure. That being said, when we get to the last one here, we're going to see blood volume is also something that plays a role in, and actually a much larger role in blood pressure. So if you're dehydrated, a lot of times it's going to be yes, the blood would be thicker, but there's also a lot less blood. So there's kind of differing effects depending on how dehydrated you are and what it's going to do to blood pressure. Vessel length is another one of these factors that is going to influence blood pressure. It'd be something that the body has to compensate for, but not something that the body is actually going to use to physiologically regulate our blood pressure. So if you have more vessel walls, you have more resistance. So more surface area means more resistance. Shorter vessels, less resistance. More vessels, more resistance. A lot of times this is going to happen as you have to lay down more blood vessels. So this idea of something called angiogenesis, which is the formation of new blood vessels. A lot of times, as we're aware of, you need to supply blood to the tissues that you have. If you have an increase in the amount of tissue you have in terms of you grow or you gain weight, you have to put down blood vessels to supply that. So one of the things a lot of times you see with obesity is a lot of times a corresponding increase in blood pressure. This is due to the fact that when you get larger, you actually have to have more blood vessels, and those more blood vessels mean more resistance and a corresponding increase in blood pressure, again, that the body has to compensate for. But again, we don't lay down new blood vessels. It's not like my blood pressure is a little low, I'm going to lay down another 3 feet of blood vessels in order to bring it up. Again, something the body has to compensate for, not something that we're using to actually regulate it. So the actual regulator of this is that blood vessel diameter. And this is a lot, the way is due to this, what is called laminar flow. So if you look at the figure at the bottom here, the bigger the lumen is, the more you're going to have that central area with this fast flow that is not going to be being slowed down. If you constrict this blood vessel, what it means is you have more slow flow and less of that fast flow in the center. If we dilate a blood vessel, it means a larger lumen means you're going to get a larger area where this flow where it can move more freely away from the walls here. So as diameter, like it says, increases there, less blood near the edges, it overall increases blood flow and it takes less pressure to push it. And because of that, blood pressure is going to be lower when these are opened up. When they are constricted, it is going to be higher. And I believe that's on the next slide here, kind of talking about the relationship between flow and radius. Main thing this comes down to, it is proportional but not linear. It's actually to the power of 4. So like it says there, a change from 1 millimeter to 2 millimeters is actually going to change the flow rate by about 16 times difference. This means small changes in vasoconstriction or vasodilation can have actually quite a large role in blood pressure changes. This is part of the reason if you get systemic vasodilation, a lot of times it's going to render you unconscious. That's what can happen when you go, like when you do that vasovagal response where your blood vessels, too many of them dilate at once and you pass out. Again, we're going to see this is controlled by that sympathetic nervous system. We generally have a little bit of resting constriction on these blood vessels, and we have the ability to either dilate them or constrict them based on need. And again, total blood flow moving through that, again, is proportional to that pressure gradient and how open the blood vessels are. Again, if we do anything that increases that pressure gradient, we're going to get a greater flow. Anything that's less, so a lot of times by dilating these blood vessels and increasing cardiac output, we can move more blood all at once, as we're going to see. But again, this starts getting into this idea that this is a multi-tiered level of regulation where yes, we can do stuff with cardiac output. We can also do stuff with blood vessels. But this kind of means if your heart rate doubles, if everything remained the same and your heart rate doubled, even if your stroke volume stayed the same, it would double your cardiac output. If blood vessels didn't change at all with that, it would also mean it would more than likely double your blood pressure. It doesn't do that because a lot of times when cardiac output increases, we're going to get vasoconstriction of certain blood vessels, vasodilation of others. So like with a fight or flight response, we'll constrict some of the main arteries, but dilate a lot of the arteries going to the muscles. And overall, that keeps that blood pressure relatively close to the normal ranges. That you're going to see an increase in it with exercise, but not a doubling or tripling of blood pressure. And again, that's because there is these dual levels of regulation and actually tri-levels of regulation we'll see when we start getting into the effect of the kidneys on this stuff. And again, the resistance is just that friction against it. Anything that increases our resistance is going to slow down blood flow and is also going to increase blood pressure. Anything that decreases resistance, such as dilation, is going to let blood flow increase, is also going to allow that to travel with less pressure. So again, very simply on this one, vasoconstriction will lead to higher blood pressure, all things remaining the same. Vasodilation will lead to lower blood pressure, again, all things remaining the same. And as I was kind of saying, with significant weight gain, a lot of times because of that, you're going to need this greater pressure because you have these more blood vessels and increased pressure needed to move this stuff through. And again, this is just kind of showing you on the nice little figure here that when you have this more open, you get a bigger flow of blood through that center that is not getting that friction, less resistance, allows it to travel on these. Anything that increases that diameter and therefore decreases that peripheral resistance is going to increase blood flow and decrease pressure. The opposite is true with vasoconstriction. You have more wall relative to the amount of volume going through, it leads to less blood getting through, and it also means that the pressure needs to be higher in this vessel for that blood traveling through because there's more friction for it to overcome to maintain flow. And really the last thing I want to talk about on this show, and again, we're going to go into this one a little bit deeper. I didn't want to make this one too long, and when we start getting into blood pressure regulation within the body and a lot of the systems that influence that, so nervous reflexes, endocrine reflexes, we're going to get a little bit more into this idea of blood volume. But blood volume, very simply, is just how much blood is there in the vessels. And again, this is pretty straightforward. It is how much blood do you have? More blood, very simply, more water in the pipes is going to be into higher pressure. It's kind of the same thing with us. More blood volume means more or an increase in blood pressure. Decreased blood volume means decreased blood pressure. This is part of the reason if you bleed a lot of times you have trouble maintaining your blood pressure because you've lost that blood volume, or if you get very dehydrated, sometimes you can pass out. Again, that is that loss of pressure due to decreased blood volume. Again, really influenced by two different things. Fluids that we take in are going to, sooner or later, that water is going to get absorbed into the bloodstream, and those things will increase blood volume. And the main thing that we physiologically a lot of times are going to regulate based on how much water we're bringing in is going to be how much we lose, which is a function of the kidneys. So your urine formation is, and we're going to see the kidneys especially, are very involved, especially once we get to the urinary system, we'll see this. Kidneys have a lot of different ways that they can influence and regulate blood pressure systemically. And this is because the kidneys need a particular pressure in order to work. And the other thing with this is that the kidneys are responsible for a lot of how much water we reabsorb, how much we let go. And it's one of those things, if your fluid intake somehow for some reason decreases, one of the things you'll see is your fluid reabsorption at the kidneys tends to go up to maintain that blood volume. But again, to keep it simple here on this one here, anything that increases blood volume, everything else remaining the same, will increase blood pressure. Anything that decreases blood volume, everything remaining the same, is going to decrease blood pressure. One of the things we'll see, and we'll talk about this in the next video, is this is a lot of times the cardiac output, the blood vessels, those tend to be short-acting regulators of blood pressure. But again, vasoconstriction has to stay there to keep that blood pressure up. Cardiac output has to stay up in order to keep that blood pressure up. as soon as those things drop, that pressure is not going to be able to be maintained. The only way that we long-term change blood pressure is generally either by bringing in more fluids or getting rid of more fluids, and we're going to see blood volume is the true long-term regulator of blood pressure. I will see you next time.